Yes, so very good evening to all of you. So this side, Dr. Saurabh Bhatia, your pharmacology guru. Okay, so how many of you are online? So I'm with you on YouTube. I'm also there with you on the Telegram group. So in case you people are there online, you people are able to listen me, you people are able to see me. Please say hi or hello to me so that I'll come to know that you people are there. So I hope you people have got a link of YouTube also. Anyone on the YouTube? So we are there with you on the YouTube channel. Okay, so anyone? I'm there with you on the live chat. Okay, so let me tell you about myself. So I am Dr. Saurabh Bhatia, and I have done my graduation, post-graduation both from Delhi University, and I have been teaching pharmacology with DBMCI since last 13 years. So I was also the student of this DBMCI. So it was a great journey from me, starting from as a student, now as a faculty over here. Okay, so today we are going to start this topic pharmacology. And you must be knowing pharmacology is about the study of the drugs. So we'll talk about the various drugs in this subject of pharmacology. So we are starting with the easy topic, which is very conceptual topic today. So gradually we will move on to the difficult topics and we'll pick up the pace also with understanding the other drugs. So I plan to teach you a topic that is autonomic nervous system. So the topic is autonomic nervous system that we are going to teach. Okay. So today's discussion will be autonomic nervous system. So anyone who is online, can you please reply? It will be great if you people will reply because it will give me a moral booster for me also. Like it will be, let's keep this session be interactive as much as possible. Okay, so I can see, yeah. Okay, so you people are there. Okay. Yes, so now I can see your names, Dr. Jyoti, Dr. V, Dr. Nihala, Dr. K, Dr. Krishna, Dr. Athira, Dr. Spurti, Anmol, Mahima, Shviraj, Siani Das, Ahana. Nice to see you there, guys. It's really, it's a kind of a good feeling for us as a faculty, like so many students are there. Okay. So, guys, let's start with the first topic that is autonomic nervous system. So, any idea what is autonomic nervous system? Let's start with the basic physiology without wasting much of time. Anyone would like to answer what is autonomic nervous system? Anyone, like whatever you know, please answer that. What is autonomic nervous system? Okay, Dr. Ahana, now you got a link. Now answer. What is autonomic nervous system? Okay, so if I ask you this question, everything in human body is controlled by which system? Answer will be CNS. So central nervous system is the one which control everything in human body. And we know that central nervous system means what? One is brain, second is spinal cord. So brain and spinal cord are the one which comprise of our central nervous system. Now the central nervous system is the one which also control our peripheral nerves. So CNS is the one which control our peripheral nerves. Now we have two types of peripheral nerves. Now we have two types of peripheral nerves. One is known as, so we have two types of peripheral nerves. First is known as sensory nerves. Second is known as motor nerves. So we have two types of motor nerves. One is known as sensory nerves. Second is known as motor nerves. So we have two types of nerves, sensory nerves and motor nerves. These are the two types of peripheral nerves we have. Yes, Dr. Hannah. So we have sensory nerves and motor nerves, two types of peripheral nerves. Now, one question which you people have already covered in your surgery class, which drugs are blocker of sensory nervous system? I would like to know the name of a class of a medicine. You people already know this point, like wherever you go for any kind of surgery, like in dental surgery, you go for any kind of RCT, you go for any type of tooth extraction or any kind of block you, if you people go for, you just inject that medicine in the patient oral cavity as well as in the base of the tooth so that your sensory nerves will be blocked. I would like to know the name of that group of medicine. Which group of medicines are there which are blocker of sensory nervous system? Anyone would like to answer? Anyone would like to answer? Which group of medicines block sensory nervous system? क्या कोई है वहां पे? Are you people there? अरे you just say good evening. You don't answer any question. Dr. Jyoti, Dr. Veep, Dr. Nihala, Dr. Krishna. You are there just to say good evening or good morning. Is there anything other? Anything else you want to say? Anything, any question you would like to answer? Let's try. Like if I say I want to block the sensation, which medicine should I give? Which medicine should I give so that the patient sensation will be blocked and you can perform any kind of surgery? You can go for RCT, you can go for tooth extraction, you can go for pulpectomy, you can go for any kind of thing you can go for. So gum, even the gum, I know about few surgeries of the dentistry. So if you want to remove the gums, if you want to do any surgery on the gums, you want to give some medicines to our patients. Which medicines are those? So that patient will not feel the pain. Now I can see some of your typing. Very good. So Dr. Jyoti has given the answer. We call them local anesthetic. Yes, Dr. Nihala. Dr. Nihala, the best part in pharmacology is whatever you will think is going to be correct. Pharmacology is simple, straightforward subject. It's not at all difficult subject. The only problem is the names of the drugs. So very good. So the medicines are known as local anesthetics. So medicines are known as local anesthetics. So local anesthetics are the medicines which are blocker of our sensory nervous system. That's fine. That's really good answer. I really like that you people have participated in this discussion. Okay, fine. Now my next question is, okay, you people have given the example also. So guys, please make a generalized thing. Any medicine that ends with the word cane, any medicine that ends with the word cane is a drug that belong to this class that is known as local anesthetics. So local anesthetics are the medicines which ends with the word cane. One classical example you people have given is lignocaine. But do you know which was the first local anesthetics used in history? The answer is cocaine. So cocaine was the first local anesthetic used in history, but nowadays this cocaine is more or less misused instead of using it for the purpose of local anesthesia. Right? So local anesthetics are the medicines which are blocker of our sensory nervous system. So local anesthetics are the medicines blocker of our sensory nervous system. Very good. Now, many of you have answered. Dr. Spurti, Dr. Ishika, Vishali, Shivraj, Hana, Kavya, all of you, Anmol, all of you have answered correctly. Okay, now guys, tell me the one thing. If I have to block the sensory nerves, I have to block the sensory nerves, I have to block the conduction or the pain sensation through the sensory nerves. Now, my question is, how these local anesthetics will act in the body? How these local anesthetics will act and they will block the sensation. So, my word is MOA. MOA stands for mechanism of action. So what is the mechanism of action of local anesthetics by which they block the sensation and patient will not feel the pain, and if patient will not feel the pain, you can perform the surgery very well without giving any kind of mental trauma to the patient in the form of pain. Anyone would like to answer? Which medicines are local anesthetics? All medicines ends with the word cane. Now my question is MOA. MOA stands for mechanism of action. What is the mechanism of action of sensory nervous system blockers, local anesthetics? How I can block a conduction through the nerve? Or I would like to take you to the basics of physiology. Now if I talk about the basics of physiology, now how a nerve conduction takes place? Anything you know? If I say the nerve conduction is taking place, do you know the name of any electrolyte which is most important electrolyte? Very good. So the answer is it is a blocker of sodium channel. So local anesthetics are the one which are blocker of the sodium channel. And by blocking the sodium channel, yes, sodium channel blocking is one first point. The second is potassium channel blocking. So these medicines are mainly the blocker of electrolytes. Very good. So electrolytes when you block. So sodium channel when you block or the potassium channel when you block. So these are the medicines which we call them local anesthetic drugs, blocker of sodium channel, and these medicines are used as a local anesthetics. Good. So this is what you people have already covered in topic of your surgery, right? Very good. So Dr. Ishika has answered, they block the entry of sodium into the membrane and therefore the nerve cannot conduct. And Dr. Ishika, do you know what happens? Do you know what happens? Like whenever we have electrolyte imbalance, like whenever we go and play outside, like when we go and play cricket for 2 hours, we go and play football for 2 hours. So after playing for 2 to 3 hours, we get lot of sweating. And because of sweating, we have this kind of abnormal sensations. We have a kind of tingling sensation in periphery. That is also the result of electrolyte imbalance. So guys, please remember for the working of our nervous system, for the working of our nervous system, electrolytes. Although we call them ions, chemistry may we call them ions, but in body we call them electrolytes. So electrolytes are very, very important for the conduction of the nerves. When we block these electrolytes, like we block the sodium, I have blocked the conduction of this nerve. So local anesthetics are the medicines which will cause blockage of the complete sensation by blocking of this electrolytes channels like sodium and the potassium channels. Right? Okay, now let's talk about the motor nerves. So motor nerves are those nerves which will supply your muscles. Now we have two types of motor nerves. We have two types of motor nerves. Number one, motor nerves which will supply voluntary muscles, motor nerves which will supply your voluntary muscles, and motor nerves that will supply your involuntary muscles. So we have two types of motor nerves that will supply your voluntary muscles and the motor nerves that will supply your involuntary muscles, right? So we have two types of motor nerves. One will supply voluntary muscles, one will supply your involuntary muscles, right? Okay, so the voluntary muscles, the nerves which supply voluntary muscles, these nerves are known as somatic nerves. These nerves are known as somatic nerves, right? And the system will be known as somatic nervous system. The system is known as somatic nervous system. Now you people have to answer me. Which muscles are voluntary muscles in human body? Please answer me this question. Which muscles are voluntary muscles of human body? I'm saying everything in human body is controlled by central nervous system. Central nervous system means brain and spinal cord, right? And ultimately, this CNS is the one which also control the peripheral nerves. Now we have two types of peripheral nerves. One is known as sensory nerves. Second is known as motor nerves. Now I have said this thing that motor nerves can be of two types. Motor nerves can be of two types. Number one, motor nerves that can supply voluntary muscles. Motor nerves that can supply involuntary muscles. Wonderful. So Dr. Ahana, Dr. Spurti, Dr. Veep, Nihala, Risana. Okay, you people have said the skeletal muscles. Skeletal muscles are the voluntary muscles. So Dr. Ahana, please make a correction over here. It's not cardiac muscles. Cardiac is something which is not under control of anyone. Yes or no? So cardiac is something which cannot be controlled by anyone. Nobody can control the heart, right? The skeletal muscles are very good. So skeletal muscles are the voluntary muscles. But skeletal muscles, as per the definition, means the muscles which are involved in body movements, right? So skeletal muscles are the one which are involved in your body movements. So whenever you move, you require your skeletal muscles. Whenever you want to move your limbs, you require skeletal muscles, right? Now, can you please tell me which muscles are your facial muscles? Like my facial muscles are voluntary muscles. Like if you ask me, sir, show us the smile, I will say, look at doctors, I can smile. Right? If you say, sir, show us the sad face, I will say, doctor, this is my sad face. Right? So I can change my expression. You ask me, sir, sir, can you please take out your tongue? Yes, I can take out my tongue. I can take my tongue back. I can move my eyeball. Right? So I can give you expression like frowning. This kind of expression I can give you. So my facial muscles are also voluntary muscles, right? So my facial muscles are voluntary muscles, but they are not skeletal muscles. They don't take part in body movements. Do you know what we call this as facial muscles? So facial muscles are voluntary muscles because guys, being as a dentist now, you people have to deal with the facial muscles. And facial muscles are not the skeletal muscles. They are voluntary, but they are not skeletal muscles. So what is the exact name that we use for these muscles? So muscles of your facial region. I'm talking about the muscles of your eyes, muscles of your tongue, muscles of your face, muscles which are under your control, present in your on your face, but they are not skeletal muscles. We call them. Answer is we call them somatic muscles. So we have a group of somatic muscles which are derived from your embryo arches. So these are the special set of voluntary muscles which are present on your face, but they are voluntary, but they are not skeletal muscle. They will not take part in any body movements, but they are under your control. So guys, please remember, voluntary muscles mein we have two types of muscles. One is known as skeletal muscles, second is known as facial muscles. These are the voluntary muscles, and the nerves which supply these voluntary muscles are known as somatic nerves, and the system is known as somatic nervous system. So this system is known as somatic nervous system. So the system is known as somatic nervous system. So somatic nervous system is the one which will supply your voluntary muscles. Now, if I ask you this question, what is the basic functional unit in the somatic nervous system? The basic unit that is present, the basic requirement of this somatic nervous system, the answer will be we have a presence of NMJ. Now, I don't know the full form of NMJ. You people have to answer me. I have told you that somatic nervous system, the basic functional unit is NMJ. Who will tell me the full form of NMJ? Like in somatic nervous system, at every point, at every end of the nerve, we should have the presence of this structure. We call it NMJ. Who will tell me what is the full form of NMJ? If I say somatic nervous system should have NMJ, it means what? NMJ means what? Anyone would like to answer? So in this NMJ, we have a presence of neuromuscular junction. Wonderful answer. So we have a presence of this neuromuscular junction over here. So we have a presence of neuromuscular junction. So in somatic nervous system, we must have the presence of neuromuscular junction. That's very good. So all of you have answered this question. I'm so happy to see Dr. Krishna, Ritu, Ani, Ahana, Athira, OMFS, Ames. I don't think so it's the name of a student, right? Dr. Jyoti, Dr. Spurti. Good. Now, next question is, in this neuromuscular junction, please remember the nerve will release a neurotransmitter and this neurotransmitter will act on a receptor. So NT means neurotransmitter. In this neuromuscular junction, one neurotransmitter is released. R means a receptor which will catch this neurotransmitter and now the muscle will be contracted. Now, who will tell me the name of a neurotransmitter and name of a receptor? So whenever that neurotransmitter is released, a neurotransmitter will act on a receptor, the muscle will be contracted. So the muscle will be contracted. Who will tell me the name of a neurotransmitter? Who will tell me the name of a receptor? Anyone would like to answer this question? So this topic, guys, you people have already covered. Yes, Dr. Kavya has given the correct answer. The neurotransmitter which is released at neuromuscular junction is always acetylcholine. So the neurotransmitter is always acetylcholine. Very good. Now, who will tell me the name of a receptor? So all of you have answered correctly. Dr. Kavya, Shivra, Jyoti, Gauri, Vishali, Anmol. All of you have answered correctly. Now you people have to answer me which receptor is present. Any student who is watching us YouTube and who is not the part of DBMCI MDS expert, so I would request you to, you can also message on the YouTube chat, right? So I'm there with the YouTube chat also. Doctor, your dentist is also there. Your dentist 27, Dr. Anusha Reddy. Please try to answer. Which receptor is present? Okay. So you people have answered. It's a nicotine receptor. Okay, good. Okay, yes. So guys, what you can do from this neuromuscular junction, you can take out the first two alphabets. So when you take out the first two alphabets, the name of the receptor will be NM. So it's a nicotinic type of receptor. N means nicotinic, M means muscle type. So it's a nicotinic receptor muscle type. So from this NMJ, if you take out the first two alphabet, the name of the receptor will become NM receptor. So acetylcholine is the one that will act on the NM receptor, and the outcome is only one, the muscle will be contracted. So acetylcholine will act on NM receptor and the muscle will be contracted. Okay, now a chocolate winning question. Let me see who will win this chocolate. Dr. Anusha Reddy, Dr. Your Dentist 27. So this question is open question for you people. Who will answer me? Which group of medicines are the one which you people have already covered in subject of surgery? Oral surgery, you people have already covered. Which medicines are blocker of NM receptor? My question is, again, I'm repeating my question. We have two types of peripheral nerves. We have sensory nerves, we have the motor nerves. Sensory nerves are blocked by the local anesthetic drugs, and we have the motor nerves, which are of two types. Motor nerves can supply the voluntary muscles, motor nerves can supply the involuntary muscles. Now, the motor nerves which supply the voluntary muscles, we call them somatic nerves. System is known as somatic nervous system. In this somatic nervous system, we have the presence of neuromuscular junction. In this neuromuscular junction, neurotransmitter is acetylcholine. The receptor is NM receptor. Now my question is, which medicines are blocker of NM receptor? What is the name of the group of the medicine which are blocker of this NM receptor and can relax the muscles? Medicines which are blocker of NM receptor and can block this muscle to contract. Muscles get paralyzed. Doctor, your dentist, yes, these are the drugs, I agree, but which drugs? These are not anticholinergic, Dr. Mishra Reddy. So you people have to answer. Try to answer, guys. I'm saying no, guys, it's not anticholinergic. We will not call them anticholinergic. We call them something else. Try to recollect. We have already covered in topic of anesthesia. We have already covered in topic of oral surgery. So in oral surgery, guys, okay, I'll give you one hint. I'm giving you one hint. Like for example, the patient is having bruxism. Patient is having bruxism. Patient has got tetany. Because of tetany, all muscles are in spasm. Now look at me. I cannot speak properly because all my muscles are in spasm. You want to relax my muscle. How will you relax my muscle? How will you relax my muscle? But is a very good. So Dr. Any Paul has given the answer. Any Paul has given the answer. The medicines are known as muscle relaxants. But Any Paul, can you please add on one more word so that this group name will be completed? Very good. Dr. Ahana, you will get a chocolate now. You're the first one who have given the full answer. Medicines are known as skeletal muscle relaxants. Medicines are known as skeletal muscle relaxants. So skeletal muscle relaxants are the ones, especially the non-depolarizing type. So non-depolarizing type of muscle relaxants are the one which are blocker of NM receptor. So these medicines are blocker of NM receptors, and by blocking this NM receptors, these medicines can relax the muscles. Okay. Now you people have to give me one more answer. See, if you are in the pharmacology class, you people have to interact with me. Otherwise, my momentum will be lost. I won't be able to teach you. Now, the next question from you people, you have to give me the example of medicines which are the non-depolarizing muscle relaxants. Which medicines are non-depolarizing muscle relaxants? Try to answer. Yes, skeletal muscle relaxants we call them. That's fine, skeletal muscle relaxants. But you people have to now answer me which medicines belong to this class. Give me one example. Give me one example of a drug which is skeletal muscle relaxant. Okay, I'll give you one hint. The medicine name, all these medicines name end with all these medicine name end with word curium or curonium. So all the medicines name ends with the word curium or curonium. Medicines name ends with the word curium and curonium. These medicines are known as skeletal muscle relaxants. Wonderful answer. So very good. I'm so happy to see that OMFS Ames has given the answer. Suresh Babu has given the answer. So one example is tubocurarine. But let me tell you that tubocurarine is one of the outdated medicines, the oldest medicine. So nowadays we have the better drugs like etracurium. We have the cis etracurium. We have the medicines like pancuronium. We have the medicine like v-coronium. So all these medicines are better used. So we call them skeletal muscle relaxants. So these are the non-depolarizing muscle relaxants. What is the mechanism of action? Mechanism of action is they are blocker of NM receptor. So these are the two group of medicines which you people have already covered in your surgery class. Local anesthetics are blocker of sensory nervous system. We have the skeletal muscle relaxants which are blocker of this somatic nervous system. And guys, you people have also covered one more group of medicines which will directly block the CNS. We call them general anesthesia drugs. So general anesthesia drugs are the one which will directly block our central nervous system, and these medicines will mainly act on the GABA pathway. So these drugs will act on the GABA pathway. So by acting on the GABA pathway, these medicines can inhibit our central nervous system. So Dr. Kavya, Vishali, Dr. NG, all of you have given the correct answer regarding this curiums. Now I have introduced one more group of medicines. We call them general anesthesia drugs. So general anesthesia drugs are the one which will block the central nervous system, and these medicines block the central nervous system mainly by acting on the GABA pathway. So who will tell me GABA is stimulatory pathway or inhibitory pathway? Anyone would like to answer? It's a physiology question. GABA is stimulatory pathway or inhibitory pathway? So GABA is stimulatory or inhibitory? Anyone would like to answer? Yes, Dr. Proton Positive. Dr. Proton Positive has answered a brand name on the YouTube, Myospaz. Dr. Myospaz to ye nahi hai. These are the skeletal muscle relaxants that we use during surgery. right? So these muscle relaxants we don't use in OPD. OPD may we use centrally acting muscle relaxant. That's totally a different class of medicine. No problem. But I'm so happy to see Dr. Proton Positive that at least you people have tried to answer. It's good. Very good. So, very good. So, all of you have given the correct answer. GABA is a inhibitory pathway. So, general anesthetic drugs are the one. General anesthesia medicines are the one that will act on the GABA pathway and inhibit the CNS. So, these medicines will act on central nervous system. So, this is a third group of medicine that you people have already covered in your surgery class. So, three group of medicines you people have already covered. One is skeletal muscle relaxants. Second is local anesthetic drugs. Third is the general anesthesia drugs. Now, today we are going to discuss about the nerves which supply involuntary muscles, right? So the nerves which will supply involuntary muscles are automatic nerves. Involuntary muscles are not under our control. So these are the automatic muscles. Nerves which will supply these muscles are known as autonomic nerves, right? So the nerves are known as autonomic nerves. So autonomic nerves are those nerves which will supply involuntary muscles of human body, right? So autonomic nerves are those nerves which will supply involuntary muscles of human body. Now we have two types of muscles which are involuntary muscles. We have two types of muscles which are involuntary muscles. Now we will use the knowledge of Dr. Ahana. So according to Dr. Ahana, cardiac muscle is an involuntary muscle. This statement is true. So cardiac muscle is a type of involuntary muscle. But guys, there is one more type of muscles which are involuntary. Apart from cardiac, we have one more type of muscles which are not under our control. Who will tell me the name of that muscle? Which group of muscles are not under our control? So one is the cardiac muscles which are not under our control. Anyone else would like to answer? Which other muscle is not under our control? Answer is answer is yes. So I have got an answer. Yes, it's a smooth muscle. Very good. So smooth muscles are also the involuntary muscles. The smooth muscles and cardiac muscles are the involuntary muscles. They're supplied by the autonomic nerves and the system is known as autonomic nervous system. System is known as autonomic nervous system, right? Now, today we are going to discuss the medicines or the drugs that will act on this autonomic nervous system. And once you complete this system, this will complete your whole group of medicines that will act on your nervous system. So we have total four group of medicines, guys. Four group of medicines that will act on your nervous system. Number one, the general anesthesia drug that will block your CNS. You have the local anesthetic drugs which will block your sensory nerves, and you have your skeletal muscle relaxants which will block your somatic nervous system, the motor part. And now today we will discuss the medicines that will act on autonomic nervous system and medicines which will affect the movement of cardiac and the smooth muscles, right? Okay. Now please remember we have two types of autonomic nerves in human body. We have two types of autonomic nerves in human body. Who will tell me the names of two types of autonomic nerves? So autonomic nerves are of two types. Yes. So smooth muscles are supplied by the autonomic nerves. System is known as autonomic nervous system. Like you have noticed one thing in somatic system, I have written over here that muscles are always contracted. But guys, in autonomic system, it's not necessary that muscle will always contract. In autonomic system, muscle can be contracted, muscle can be relaxed. That's why God has given us two type of autonomic nerves. God has given us two type of autonomic nerves. One will cause contraction of muscle, other will cause relaxation of muscles. I'm talking about which muscles? Answer is I'm talking about involuntary muscles. So I'm talking about involuntary muscles. So whenever we are running, our heart muscles will contract fast. Whenever we are not running, our heart muscles will contract less. Right? Very good. So we have two types of autonomic nerves. One is known as parasympathetic. The other is known as sympathetic. So first is known as parasympathetic nerves. Second is known as sympathetic nerves. So we have two types of autonomic nerves. One is known as parasympathetic. Second is known as sympathetic nerves. So we have two types of two types of autonomic nerves. One is parasympathetic. One is sympathetic. Right? Okay, now we'll discuss the difference between two. So if we talk about this autonomic nervous system, so we have two types of nerves over here. One is known as parasympathetic nerves. Second is known as sympathetic nerves. So we have two types of nerves. One is known as parasympathetic nerves. Second is known as sympathetic nerve. Now guys, we have to understand as a doctor one thing. Although God has given us two type of autonomic nerves. One is parasympathetic, one is sympathetic. But at a given point of time, we required only one. Right? When we require sympathetic, we don't require parasympathetic. When we require parasympathetic, we don't require sympathetic. Right? So at a given point of time, we required only one. Now you people have to tell me which nerves are required when we are not in stress and which nerves are required when we people are in stress. So we have two types of autonomic nerves. One is parasympathetic, one is sympathetic. Out of two, at a given point of time in a life, we required only one. Right? Either we required parasympathetic or we required sympathetic. When we required parasympathetic, we don't require sympathetic. When we require sympathetic, we don't require parasympathetic. Anyone would like to answer? In stressful scenario, we required which system? In stressful stimulus to the human body, we required, answer is very good. So S is for S. S is for S, very good. So sympathetic system is activated whenever we have stressful stimulus to human body. So whenever we have stressful stimulus to human body, our sympathetic system get activated. And as long as we are in non-stressful environment, as long as we are in non-stressful environment, our parasympathetic system remain activated all the time. Like I am teaching right now, I'm teaching pharmacology to you people. And you know, I'm teaching pharmacology since last 13 years. So teaching a pharmacology to you people is a non-stressful event in my life, right? So right now I am teaching on my parasympathetic system, right? So, but what will happen? Like while teaching pharmacology, suddenly I just got down from this chair, right? So if I fell from, if I fall down from this chair, immediately what will happen? My sympathetic system got activated. Similarly, like you people are listening this lecture. Like Dr. Ahana is listening this lecture, so she is very comfortable right now, right? So her parasympathetic system is activated right now. But moment I will point at her, okay, Dr. Hana, answer me this question. What is sympathetic nervous system? The moment I will take her name, her sympathetic system get activated. Now again, she's smiling. She is now again relaxed. Now again, her parasympathetic is activated. So in this way, so we have this fast changing of the system. So parasympathetic and sympathetic in the life. So guys, please remember all important events of the body, all normal physiological events of the body, like we eat the food, we absorb the food, we digest the food, we assimilate the food, we take out energy out of the food, we excrete, we urinate. All these activities are due to parasympathetic system. So parasympathetic system is the one which remain activated all the time in the body. But whenever we people come in stress, our sympathetic system get activated. Right? And please remember, whenever sympathetic system is activated, our all normal physiological activities, our body, all normal physiological activities will be inhibited temporarily. So all actions like our digestion is inhibited, right? Our ATP's production will be inhibited. So all our functions of the body will be temporarily inhibited the moment we come in stress, right? Okay, now my next question is, parasympathetic nerves. If I talk about the parasympathetic nerves, so parasympathetic nerves, they come out of CNS. Like I told you, everything is controlled by central nervous system. So even the autonomic nervous system is also controlled by CNS. Now the parasympathetic nerves, which starts in CNS and they will come out in periphery. They will come out of central nervous system and supply the peripheral muscles, peripheral involuntary muscles. Now, from which portion of the body parasympathetic nerves will come out of CNS? Have you understood my question? My question is, parasympathetic nerves are the one which are connected with the brain because everything is controlled by the brain and the spinal cord. Now, these nerves, which are parasympathetic nerve I'm talking about, they are ultimately starting from CNS and they are coming out of the CNS. My question is, from which part of the CNS these nerves will come out? So the answer is craniosacral part. So parasympathetic nerves are also known as craniosacral outflow. So parasympathetic nerves are also known as craniosacral outflow and sympathetic nerves are known as thoracolumbar outflow. So these nerves are known as thoracolumbar outflow. It means sympathetic nerves are connected with spinal cord and they will come out from the thoracic and the lumbar part of the spinal cord. But if we talk about the parasympathetic nerves, Parasympathetic nerves are connected with the brain and spinal cord both, and they will come out from the brain as well as from the sacral region. That's why we call them craniosacral outflow. So parasympathetic known as craniosacral outflow, and sympathetic is known as thoracolumbar outflow. Now here there is only one important MCQ. The question is, the only important MCQ they will ask you, which cranial nerves are known as parasympathetic nerves? So guys, you must be knowing, because you people are dentists, you know the neuroanatomy more than me. So I'm just a pharmacologist in front of you. So you people know anatomy more than me. So you people have to answer me one question. We have total 12 pair of cranial nerves, right? So we have total 12 pair of cranial nerves. But my question is, out of these 12 pairs of cranial nerves, which four pairs are known as parasympathetic nerves? So which are the four nerves which are known as parasympathetic? I just want to know this point. What are the names of the four nerves? What are the numbers of the four nerves which supply involuntary muscles of your body? Which cranial nerves are parasympathetic nerve? I know there are total 12 nerves, but out of 12 nerves, all 12 are not parasympathetic. All 12 are not parasympathetic. They should be very good. So Dr. Kavya has given the answer. There are four cranial nerves which are known as parasympathetic nerve. The names are oculomotor, cranial nerve number 3, cranial nerve number 7, 9 and 10. So cranial nerve number 3, 7, 9 and 10. These are the four cranial nerves which are known as parasympathetic nerve. Now Dr. Kavya and Spurti, one difficult question for you people. You people have to answer me. Dr. Kavya, Dr. Spurti, what is 2, 7, 9, 10? Dr. Ahana, you can also participate in that. So you people have answered cranial nerve number 3, 7, 9, 10 are the parasympathetic nerve. Now guys, what is 2, 7, 9, 10? What is 2, 7, 9, 10? Dr. Kirti Jain, you are on the YouTube. Dr. Your Dentist, you are also on the YouTube. You people can also answer this question. So cranial nerves 3, 7, 9, 10. These are the, no doubt, these are the parasympathetic nerve. But how, my question is, what is 2, 7, 9, 10 if you remember? Do you remember what is 2, 7, 9, 10? This is something related to clotting factors. 2, 7, 9, 10, something related to clotting factor. 2, 7, 9, 10. Have you heard about 2, 7, 9, 10? Okay, no problem, guys. I'll tell you. 2, 7, 9, 10 are the four clotting factors. 2, 7, 9, 10 are the four clotting factors which are dependent on vitamin K. Which are dependent on vitamin K for their activation. So any patient who suffer from vitamin K deficiency, any patient who has vitamin K deficiency, he would be suffering from deficiency of 2790. Very good. Dr. Kavya, Dr. Athira, Dr. Vishali. So please don't get confused with 37910 and the 27910. 27910 are the four clotting factor, and 37910 are the names of the four cranial nerves which are known as parasympathetic nerve. Now the next question is, which neurotransmitter is released in parasympathetic system and which receptor is present in parasympathetic system? Now next question, if you people have understood, which neurotransmitter is released and which receptor is present? Anyone would like to answer? In parasympathetic nervous system. So far we have discussed parasympathetic system is a system that is activated or that remain activated as long as we are not in stress. So as long as we people are not in stress, our parasympathetic system activated all the time. That's fine. Now this is also known as craniosacral outflow, where the 3, 7, 9, 10 are the nerves which are cranial nerves, and they're also parasympathetic nerves. Now, my question is, which neurotransmitter? Which neurotransmitter is released in parasympathetic system? So, parasympathetic nerves will release a neurotransmitter. The name of the neurotransmitter is acetylcholine. Wonderful. So, this is again acetylcholine, and that's why this system is also known as cholinergic system. So, parasympathetic system is also known as cholinergic system because here the neurotransmitter is acetylcholine. That's really good. So I'm so happy to see you guys. At least you know the basics. So Kavya, Veshali, Ahana, very good for that. Now you people have to answer me. What is the name of a receptor? What is the name of a receptor which is present over here? Acetylcholine is released. That's fine. So Anusha Reddy, anyone? The name of the receptor is M, that is muscarinic, right? So please remember the name of a receptor is only one, muscarinic. So please remember on the surface of all smooth muscles, on the surface of all smooth muscles and the surface of all cardiac muscles. So on the surface of all smooth muscles and cardiac muscles, we have M. So M is for muscle, M is for muscarinic. No, Dr. Spurti, this is what I wanted to explain you. It's not nicotinic, it's muscarinic. Again, we will go back. Again, I want to explain you one thing. Look at here. So we have two systems. One is known as somatic system that will supply the voluntary muscle. We have one autonomic system that will supply the involuntary muscle. Now, in somatic system, that is a voluntary muscle, we have a receptor that is nicotine M, nicotine muscle type receptor. But please remember, on the surface of involuntary muscles, we do not have nicotine receptor. We have only and only muscarinic receptor. So we have only and only muscarinic receptor. So acetylcholine will act on muscarinic receptor in parasympathetic system. Right? Just remember this point. No, it's muscarinic. It's not nicotinic. It's muscarinic. Mushroom. Mushroom से मिला है. We have derived this receptor from mushroom. Muscarinic receptor. Colorful mushroom. M means mushroom. M means muscarinic. M means muscles, which are involuntary muscles. Okay, now I would like to answer. I would like to ask one question, just for the just want to know whether you people have understood or not. I'm writing the names of four muscles. I'm writing the names of four muscles. One is the biceps. One is the one more muscle is lateral rectus. Lateral rectus of the eye. So lateral rectus of eye. Second is biceps. Third muscle I am writing triceps. The fourth muscle I am writing bronchioles. Fifth muscle I am writing uterus. Sixth muscle I am writing the stomach. Now please tell me where we have the nicotine receptor, where we have the muscarinic receptor. Please answer. So question is 1, 2, 3, 4. You need not to write the muscles names again. You have to just write 1, 2, 3, 4, 5, 6. So in 1, 2, 3, 4, 5, 6, which receptors are present? Please answer. 1, 2, 3, 4, 5, 6. Which receptors are present? Please answer me fast. No one would like to answer? So biceps, lateral rectus, triceps, bronchiole, uterus, and stomach. I hope you are aware of the structures of the body. Which receptors are present? No, Dr. Hana, you have to answer me in detail. Nicotinic receptor is of two types. Nicotine receptor is of two types. You have to answer me which type of nicotinic. Nicotinic muscle type or nicotinic nerve type. We have two types of nicotine receptor. I told you in starting. Nicotinic which type? Nicotinic which type? Muscle type or nerve type? Nicotinic muscle type. Very good. So here we have the nicotinic receptor muscle type. Here the M means muscle. So we have two types of nicotinic receptor. So nicotinic receptor muscle type is present on the voluntary muscle. These are the voluntary muscles of the body. And these three are the involuntary muscles. And because these three are involuntary muscles, here we have the receptor, we call it muscarinic receptor. So here we have muscarinic receptor. Have you noticed in on the surface of all involuntary muscles, we always have muscarinic. We do not have nicotine receptor. We always have muscarinic receptor. Right, guys? Okay, now let's move on to sympathetic system. Now in sympathetic system, please remember the neurotransmitter. In sympathetic system, the neurotransmitter is noradrenaline. So here the neurotransmitter name is noradrenaline. So NADR, full form is noradrenaline, which is also known as norepinephrine. So here the name of a receptor is, here the name of the neurotransmitter is noradrenaline, which is also known as norepinephrine. So noradrenaline is also known as norepinephrine. So this system is also known as adrenergic system. So this system is also known as adrenergic system. Here the receptor, here the neurotransmitter is noradrenaline, which is also known as norepinephrine. Now here the receptors are totally different. Here the receptors are alpha or beta. So here the receptors names are alpha or beta receptors. So here we have two types of receptors. Names are alpha or beta receptors. So noradrenaline, also known as norepinephrine, This will act on alpha and beta receptor. Now, in this autonomic nervous system, guys, you people have to remember one point, and the important point is in okay. First of all, answer my one question. Most of the time of the day, most of the time of the day, which system remain activated? Parasympathetic or sympathetic? Please answer. I'm talking about a normal human being. I'm not talking about a doctor. डॉक्टर का तो different system activate रहेगा, but I'm talking about the normal human being. In a normal human being, which system remain activated most of the time? Sympathetic or parasympathetic? Anyone would like to answer? Most of the time of the day, which system remain activated? Yes, very good, Spurti. So Dr. Spurti has given the answer. It's a parasympathetic system. So parasympathetic system is the one which remain activated almost throughout the day. But guys, whenever we people come in stress because of any reason, like whenever we have any kind of stressful event, like we people fall down from somewhere, we people trip, we will have a trip somewhere, like we people like we got some mental stress. So on this occasions we have a stressful environment, so there was sympathetic system will come in between. Now guys, please remember, in this autonomic nervous system, whether we are talking about sympathetic or we talk about parasympathetic, wherever we have nerve and nerve junction, right? So in this sympathetic and parasympathetic, wherever two nerves will make a junction, so we're talking about both system, this is applicable to both system, wherever the nerve and nerve will make a junction, right? So please remember, in sympathetic and parasympathetic, wherever the nerve and nerve will make a junction, again the neurotransmitter is acetylcholine, and here the receptor is nicotine N type, nicotine nerve type. Guys, if you can make a mnemonic, double N means two N, two nerve, nerve and nerve junction. So wherever we have nerve and nerve junction, we have NN. If you go back, wherever we have nerve and muscle junction, we have NM, right? So wherever we have nerve and muscle junction, we have NM. Wherever we have nerve and nerve junction, we have NN. And on the surface of all involuntary muscles, we have M, that is muscarinic. So if you can remember this point, this is the main crux of the discussion, whatever we have done so far. How many of you have understood? Because I'm taking a halt here for 2 minutes just to solve your queries. So in case guys, you people have any query, please ask. If you people have any query, please ask. Otherwise, I will move on to the next topic. If you people have any query, please ask. No query. Okay, that's really good. If you people don't have query, it's good for me. Okay, now let's talk about a system, that is parasympathetic system. So I'm starting with parasympathetic system. So I'm starting with the first system, parasympathetic system, right? So if we talk about this parasympathetic system, which is also known as cholinergic system, this is also known as cholinergic system or the parasympathetic system. We have two types of medicines. We have two types of drugs that will act on this parasympathetic system, right? We have two types of drugs that will act on here. One is known as cholinergic drugs. One is known as cholinergic drugs, and second is known as anticholinergic drugs. So we have two types of medicines that will act on the system. One is known as cholinergic drugs, second is known as anticholinergic drugs. Now before the starting of this discussion of the medicines, let's talk about the basic physiology once again. So again my question, what is the name of a neurotransmitter? What is the name of a neurotransmitter released in parasympathetic nervous system? Can you please answer? What is the name of a neurotransmitter which is released in parasympathetic system? Guys, you people have to answer. Otherwise, so difficult हो जाएगा. So, which neurotransmitter is released in parasympathetic nervous system? Answer is no. You people have to answer. Without answering, I will not move ahead. Very good. So, name is acetylcholine. So, acetylcholine is a name of a neurotransmitter. Now, if I say how this acetylcholine synthesis will take place in our body, how the acetylcholine synthesis will take place in the body. So please remember, acetyl CoA is one chemical compound. This will bind to choline. right? So acetyl CoA is one chemical compound. This will bind to choline and this will form acetylcholine. So how the acetylcholine synthesis will take place? Acetyl combines with choline. This will form acetylcholine. Now this acetylcholine will be stored in a vesicle. Acetylcholine will be stored in a vesicle which is present at the end of the nerve. So I will say this is any cholinergic nerve. So this is my cholinergic nerve which can release acetylcholine. This is my cholinergic nerve. In this cholinergic nerve, acetylcholine synthesis will take place. Now, how this acetylcholine synthesis will take place? Very easy. Acetyl combines with choline and this will form acetylcholine. And now this acetylcholine will be stored in this vesicle. So this is the vesicle. So vesicle is a storage granule. Neurotransmitters are stored in vesicle. So structure is known as vesicle where acetylcholine is stored. Right? Now, whenever body requires, acetylcholine is released from this nerve. So acetylcholine will be released by this nerve whenever body requires. So whenever body requires, acetylcholine will be released from this nerve ending. Right? Now, question arises how this acetylcholine is released. So please remember, acetylcholine is released by this nerve with the help of some fusion proteins over here. So we have some fusion proteins present over here. With the help of the fusion proteins, this membrane of the vesicle fuses with the membrane of the nerve. So vesicle membrane fuses with nerve membrane. Vesicle membrane fuses with nerve membrane with the help of fusion protein. And one of the important fusion protein is known as SNAP25 protein. So name of a fusion protein is SNAP25 protein, right? So acetylcholine is stored in a vesicle. During its release, the membrane of this acetylcholine vesicle fuses with the membrane of the nerve, which requires a protein. We call it fusion protein. So this required a protein. We call it fusion protein. The name of the fusion protein is SNAP25 protein. Now, whenever this membrane will fuse with each other, there is entry of one ion that will take place, and this ion is known as the calcium ion. So calcium will take entry, and when this calcium will take entry, acetylcholine is released. So what are the three events here? The first event is fusion protein. So fusion of acetylcholine vesicle membrane will take place with the membrane of the nerve. So this fusion will take place with the help of which protein? SNAP25 protein. Second is entry of which ion? Answer is calcium ion. After this calcium ion, the third event is release of acetylcholine. Right? Now, who have understood this? Can you please write these three events in the message if you have understood? What are the three events? How acetylcholine is released? These are important for your exam. That's why I'm stressing upon this point. Anyone would like to answer? How this acetylcholine is released? Anyone would like to answer? How this acetylcholine is released? Okay. So one is the fusion. First step is fusion with the help of fusion protein. Second is the calcium entry. And third is the release of the acetylcholine. Okay. So three things will take place. Now we have a drug which is blocker of all these three events. The name of the drug is botulinum toxin. So we have a medicine. The name of the medicine is botulinum toxin. So botulinum toxin, very good. So Dr. Gauri, Dr. Vaishali has answered correctly. So first is fusion protein. Dr. Shivraj, very good for this. Calcium has taken the entry and then this acetylcholine is released. Now we have a drug. The drug name is botulinum toxin. The brand name of this medicine is Botox. The brand name of this medicine is Botox. So Botox or the botulinum toxin is a drug which is blocker of this fusion protein. So this medicine is blocker of this fusion protein. And when we block this fusion protein, then the calcium entry is also not possible. So botulinum toxin, which is known as Botox, this is inhibitor of SNAP25 protein. And by inhibiting SNAP25 protein, calcium cannot take entry. When this calcium cannot take entry, acetylcholine will not be released. The drug name is botulinum toxin. Now the first MCQ will be asked to you, what is the origin? from where we have obtained botulinum toxin. So the answer is botulinum toxin is a drug that we have obtained from a bacteria. The name of the bacteria is Clostridium bacteria. So we have obtained this Botox from a bacteria. The name of the bacteria is Clostridium bacteria. Now Clostridium is a bacteria which can produce seven type of toxin. Clostridium is a bacteria which can produce seven type of toxin. But clinically as a doctor, we people use only type A toxin, or maximum we use type B toxin. We people do not use type C, D, E and F toxin. So we do not use C, D, E and F. We only use type A, maximum we use type B. So Botox that we use clinically, that is type A toxin, maximally it's type B toxin. We do not use C, D, E, F clinically. So origin is from Clostridium. The toxin name is type A followed by type B toxin. Now, what is the mechanism of action of this medicine? How this medicine will act in the body? So that we have already covered. This medicine is inhibitor of SNAP25 protein. So this medicine is inhibitor of SNAP25 protein, and this is inhibitor of SNAP25 protein in a very unique way. How it is a blocker? It's a irreversible blocker. So this medicine is a irreversible blocker of SNAP25 protein. So this medicine is a reversible blocker of SNAP25 protein, and by blocking this SNAP25 protein, then the calcium entry is not possible. Calcium entry is not possible, and when this calcium entry is not possible, then obviously acetylcholine release is not possible. And when this acetylcholine release is not possible, what will happen to the muscle? The muscle will be contracted or relaxed. The answer is the muscle will be relaxed, right? So the muscles will be relaxed, the muscles get paralyzed, the muscle will be relaxed. Now guys, any idea how we give Botox to a patient? Botox ka what is the route of administration? How we give Botox to a patient? What is the route of administration? Do we give this medicine by the systemic route or by the local route? Anyone would like to answer? If you people have ever used this Botox, because dentistry where Botox has a great importance, you people use Botox like anything, right? So who will tell me the route of administration? How this medicine is given to a patient? Is this medicine given by systemic route or by the local route? Answer is this medicine is given by the local route. Wonderful answer. So this medicine is always given by the local route, and the dose of this medicine is calculated in which unit, guys? Milligram, microgram, milliliter, microliter, units, micro units. In which parameter we calculate the dose of the medicine? How we calculate the dose of the medicine? So the dose of the medicine is calculated in units, right? So dose of the medicine is calculated in units. No, Dr. Ishika, Dr. OMFS, you people have to understand. We inject the medicine directly in the muscle which we want to relax. So that is not intramuscular route. Intramuscular route is systemic route. Like intramuscular means like you give the medicine in between the muscle, but the medicine will take entry in your plasma and medicine will act somewhere else. No, it's not like that. We give the medicine in the muscle, right? We give the medicine inside that muscle which we want to relax. That's the local route. Local route means when you give a medicine at a place where the pathology is present and you don't want the medicine should go to the systemic circulation. So without taking entry in the systemic circulation, if a medicine is acting in your body, that route is local route. If medicine has taken entry in the systemic circulation to produce its effect, that route becomes systemic route, right? So this is the medicine is directly injected in muscle which we want to relax. So drug is given by the local route and the dose of the medicine is calculated in units. Now any clinical utility, any indication of the medicine you people know? How we give this medicine to I mean for what purpose we give the medicine to a patient? Any utility, any indication of the medicine you people know? So nowadays we can use this medicine for many indications. So questions usually not asked on the indications because nobody can remember all the indications where the medicines are useful, right? So this medicine is given, yes, this medicine is given for the treatment of wrinkles. So if you have the wrinkles over face, this medicine can be given for the treatment of wrinkles, right? If you look at me, like most common site of wrinkle is this forehead. Like if you can see this wrinkle on my forehead right now. So this is a wrinkle. What I will do, I will inject medicine over here. So this wrinkle get over relaxed. And once this wrinkle is over relaxed, you cannot see this wrinkles on my face. So I will look young. So treatment of wrinkles, treatment of any spasticity. So wherever you want to relax the muscle, I can use this medicine. Now, who will tell me the duration of action? I'll give you one hint, and you people have to pick up that hint and answer me that question. So this drug is irreversible inhibitor of this protein. And because this medicine is irreversible inhibitor, so my question is this drug will be long acting or shorter acting? Medicine action in the body lasts for long time or short time? Anyone would like to answer? If I say the drug is irreversible blocker, it means the duration of action of the medicine is longer acting or shorter acting. Anyone would like to answer? Medicine action is long acting. Medicine action lasts for long time or short time? Answer is very good answer. So medicine action lasts for a long time. Medicine action is seen up till 2 to 3 months. So single injection, single sitting of Botox action is seen can be up till 2 to 3 months. So medicine action can be seen up till 2 to 3 months. So medicine is long acting medicine. This is all about acetylcholine synthesis and all the MCQs which are based on botulinum toxin. This is what we have covered. The second point we can cover acetylcholine metabolism. So after this acetylcholine synthesis, we can discuss acetylcholine metabolism. So if we talk about acetylcholine metabolism, so please remember acetylcholine metabolism will take place with the help of an enzyme. The name of the enzyme is acetylcholine esterase enzyme. So acetylcholine metabolism is possible with the help of acetylcholine esterase enzyme. So acetylcholine metabolism is possible with the help of acetylcholine esterase enzyme. Right. So just remember the name of the enzyme is acetylcholine esterase enzyme, which is involved in metabolism of acetylcholine. Now, where do we have this acetylcholine esterase present? So acetylcholine esterase is present in the synaptic cleft. So this enzyme is present in the synapse. Synapse between nerve and nerve. Synapse can be between nerve and muscle, right? So any nerve and muscle synapse, any nerve and nerve synapse, we can have the presence of this enzyme known as acetylcholine esterase enzyme. Now, just like acetylcholine esterase, we have one more enzyme. We have one more enzyme. We call it pseudocholine esterase. We have one more enzyme. We call it pseudocholine esterase enzyme. So pseudocholine esterase is an enzyme which is present in our plasma. So the same enzyme is present in plasma but with a different name. The different name is pseudocholine esterase enzyme. Right? So how the acetylcholine is metabolized? So acetylcholine is metabolized in synaptic cleft with the help of the enzyme known as acetylcholine esterase enzyme. The same acetylcholine can be metabolized in plasma with the help of a different enzyme. The name of a different enzyme is pseudocholine esterase, but the working is almost same. So we have two types of enzymes which are involved in acetylcholine metabolism. One is acetylcholine esterase enzyme. Second is pseudocholine esterase enzyme. Their locations are important to remember. Pseudocholine esterase starts with alphabet P. So it is present in P plasma, and acetylcholine esterase present in synaptic cleft wherever the acetylcholine is released. This is how acetylcholine metabolism takes place. After this acetylcholine metabolism, we can again discuss acetylcholine receptors. So if we talk about acetylcholine receptors, we have two types of acetylcholine receptors that we have already covered. So we have a nicotine receptor, we have a muscarinic receptor. So we have a nicotine receptor, we have a muscarinic receptor. Now nicotine receptor is of two types, nicotine N type, nicotine M type, right? So acetylcholine receptors are of two types. Number one, nicotinic receptor and muscarinic receptor. Now, nicotine receptor two types: nicotine N, nicotine M. Nicotine nerve type, nicotine muscle type. Full form is nicotine nerve type, nicotine muscle type. Now, if we talk about muscarinic receptor total 5 types. Muscarinic receptor total 5 types, M1 to M5. Now, total receptors are 7. Total receptors are 7, and please remember all receptors, total 7 receptors are stimulatory in nature. So all receptors are stimulatory in nature except muscarinic 2 and muscarinic 4, which are inhibitory in nature. Right? So all receptors are stimulatory except muscarinic 2 and muscarinic 4, which are inhibitory in nature. So muscarinic 2 and muscarinic 4 are inhibitory. Rest of the receptors are stimulatory. Right? So now you people have to answer me. Very good. So I'm so happy to see there are so many doctors who are logged in at YouTube channel and they are watching this video. Very good. So we have total 7 receptors. All 7 are stimulatory except muscarinic 2, muscarinic 4. Now you people have to answer me this question. Where do we have these receptors? We have already covered. Let me check you how you have understood, how much you have understood. Who will answer me? Where do we have the receptor nicotine N type? Where do we have the nicotine N type of receptor? Anyone would like to answer? Where we have this nicotine N type of receptor and where we have the nicotine M type of receptor? Nicotine nerve type, nicotine muscle type. Anyone would like to answer? Okay. So nicotine N type of receptor is present. Very good. Wherever we have nerve and nerve junction. So wherever we have nerve and nerve junction, there we have nicotine N type of receptor. So wherever we have nerve and nerve junction, there we have nicotine N receptor. Now where do we have this nerve and nerve junction? So we have this nerve and nerve junction present in autonomic system and the same nerve and nerve junction present in CNS. So same nerve and nerve junction present in CNS. Now guys, please remember in autonomic nervous system, in autonomic nervous system, there is a special name. There is a special name given to this nerve and nerve junction, and the name is ganglia. So, in autonomic nervous system, this is known as ganglia. But the same nerve and nerve junction in central nervous system. In autonomic nervous system, the name of nerve and nerve junction is ganglia. The same nerve and nerve junction in CNS is known as nucleus. The same nerve and nerve junction in CNS is known as nucleus, and you must have covered multiple types of nucleus in your uh, anatomy class, neuroanatomy. So in CNS, the same nerve and nerve junction is known as nucleus. In autonomic system, we call it ganglia. Right? Yes, so Dr. NG, you have answered adrenal medulla. Adrenal medulla is an example of ganglia. Adrenal medulla is not an organ. Please remember, adrenal medulla कुछ भी नहीं है. Adrenal medulla is just a junction of nerves. So whenever one nerve is coming, other nerve will go out. This will make a junction. This is medulla. Similarly, we call it ganglia. Similarly, we call it nucleus. So the nerves will come, other nerves will go out. We call it ganglia, or we also call it nucleus. Okay. Now come to the NM receptor. So you people have answered already. This is present at neuromuscular junction. This is present at neuromuscular junction, which is a part of which system? Answer is somatic nervous system. Now guys, who will answer me what is somatic nervous system? You people have answered me, like I can see Dr. Krishna, Dr. Annie Paul, Dr. Ahana. You people have answered that NM receptor is present at neuromuscular junction. Now this is the part of somatic nervous system. Now my question is, what is somatic nervous system? Somatic nervous system is the one that will supply what? That will supply what? Somatic nerves are those nerves that will supply what? No one can answer. So you people have answered that NM receptor is present at neuromuscular junction. That's fine. Answer is correct. Like I can see in the group, many of you have answered this. Very good. Dr. Anjali has given the correct answer. Dr. Nihala has given the correct answer. Somatic nervous system is the one that will supply your voluntary muscles. Wonderful answer. So on the surface of your all voluntary muscles, on the surface of all voluntary muscles, you have NM receptor, and on the surface of all involuntary structures, on the structure of your all involuntary muscles, you have the muscarinic receptor. Right? NM voluntary, muscarinic involuntary. Nicotine N means nerve junction. It is only present over nerves. It cannot be present over muscle. It is always present over nerve. Now here they will ask you where we have the presence of muscarinic 1 receptor. right? So please remember, muscarinic 1 receptor has two locations. There are two locations of muscarinic 1 receptor. Number one, it is present in our GIT. It is present in our GIT where it is involved in acid secretion. Where it is involved in acid secretion, we also have the same receptor present in CNS, and in CNS, this is involved in tremors. This is involved in tremors. So GIT, acid secretion, CNS में they are involved in tremors. Muscarinic 1. Now we have the muscarinic 2 receptor. Now muscarinic 2 is an inhibitory type of receptor. It is present over heart. So muscarinic 2, it is present over cardiac muscles or heart. Now this is a type of inhibitory receptor. So the heart is going to be inhibited. Now we have the muscarinic 3 receptor. Now muscarinic 3 receptor is the one which is present over all smooth muscles of the body. It is present over all smooth muscles of the body, and this is a stimulatory type of receptor, and this will contract the smooth muscle. This will contract the smooth muscle, right? So please remember, M4 and M5 receptors are not important for your examination point of view. So we'll not go in detail. The reason is like we people don't have drugs which act on muscarinic 4 and muscarinic 5. So as a doctor, no need to know about the location of muscarinic 4 and 5. Just remember muscarinic 1 present in GIT and CNS, stimulatory type. So they will increase acid, they will cause tremors. Muscarinic 2 inhibitory type. This will block or inhibit the heart, and muscarinic 3, this is present over all smooth muscles, and all smooth muscles will be contracted. All smooth muscles will be contracted. This is all about the locations of this receptor. Now after this location, we will discuss about the acetylcholine actions in the body. Now before starting with acetylcholine actions in the body, you people have to answer me. You people have to ask me if there is any query, not answer. This time you can ask any query. Dr. Veeb, this is correct answer. Do you have any query up till here? Do you want to know anything up till here? If you have any curiosity to know anything. Yes, Dr. Neelam Gharti, facial nerves. We have the facial nerves. Facial nerve is a seventh nerve, right? The facial nerve is a seventh nerve. Dr. Bharti, which is there on the YouTube, she has asked about the facial nerve. The facial nerve is which nerve, guys? Can you please help her? Facial nerve is which nerve? Sensory nerve, motor nerve, somatic nerve, or autonomic nerve? Facial nerve is which nerve? Okay, chalo, let's play a game. I'll ask three questions from you. You people have to answer me the nerve supply of that region. Okay, my first question, which sensory nerve? Which sensory nerve is present for the anterior one third of the nerve? So taste sensation. Taste sensation is carried by which nerve from the anterior one third of the tongue? So anterior one third of the tongue, which nerve will carry the taste sensation? And which nerve will supply your salivary glands? And which nerve will supply your facial muscles? Answer is seventh nerve. So yes, very good answer. So Dr. Ahana, Dr. Vishali has given the answer. There's a mixed nerve actually. Nerve to एक ही है. In that nerve we have different fibers. Like if I say the facial nerve, my facial nerve is this. Now this facial nerve has three kind of fibers. The green color is showing the sensory fibers. Chorda tympani, carrying the taste sensation from the anterior one third of the tongue. This is chorda tympani. Now we have this nerve. This red color is showing you the autonomic part. This is the autonomic nerve supplying your salivary glands. Supplying your salivary glands. Now the blue color is showing you the somatic part of the nerve. Now somatic fibers will supply your facial muscles. So the nerve is one. Nerve is one, that is facial nerve. Nerve आपका one है, seventh nerve है. But this nerve has different type of fibers. This nerve has different type of fibers, and these fibers are somatic, autonomic, and sensory. Right? So this concept is now clear. Okay. Yes, cardiac muscles pe we have muscarinic 2. Dr. Sovam Kumar Bhaumik has answered. Okay, guys, what are the actions of acetylcholine? So for the actions of acetylcholine, you people have to remember this mnemonic. The mnemonic is dumbbells. So the mnemonic is dumbbells. In this mnemonic or dumbbells, the D stands for diarrhea. So acetylcholine can cause diarrhea. So this can increase the peristalsis in the body. So by increasing the peristalsis, this will cause diarrhea. Now this D also stands for dilatation of the blood vessel. This will also cause dilatation of blood vessels. So this will also cause dilatation of the blood vessels. So blood vessels will be dilated. So the BP will go down. BP will go down, right? So acetylcholine actions, you can remember with this mnemonic, that is dumbbells. And in this dumbbells, all the actions are due to muscarinic 3 because muscarinic 3 is present everywhere in the body except on the heart where we have muscarinic 2. So all the actions are due to muscarinic 3, right? All the actions are due to muscarinic 3, but on heart we have muscarinic 2, right? So blood vessels will be dilated again due to M3. Diarrhea will occur again due to M3. BP will go down again due to M3. Now, U stands for urination. So patient is able to pass urine because the bladder will be contracted. Because the bladder will be contracted, this is again due to M3, right? Now here the M. M stands for meiosis. So M stands for meiosis. This meiosis will occur due to M3. But please remember, along with meiosis, you have to write one more word, that is accommodation. So meiosis with accommodation again due to M3, right? So meiosis with accommodation that will take place again due to M3. So the mnemonic is dumbbells. M stands for meiosis with accommodation. Now here we have the bradycardia. So B stands for bradycardia. Now bradycardia is due to M2. Bradycardia is due to M2. Rest of the actions are due to M3. Now here the B also stands for bronchospasm. B also stands for bronchospasm. Now bronchospasm is again due to M3, right? Next is E. E stands for erection. So in male patients, erection occurs for sexual activity. This is again due to M3. Then we have the mnemonic L. L stands for lacrimation. L stands for lacrimation. S stands for salivation. S also stands for sweating. So all glandular secretions are increased again due to M3. Again due to M3. And the last one is increased secretion of acid. Increased secretion of acid in the GIT. So acid secretion is increased in the GIT again mainly due to M3. But here we also have the presence of M1 that we have already covered. Here we also have the presence of M1 that we have covered. So secretion of acid is due to M3, mainly due to M3, but we also have the M1. So guys, now next 5 minutes take to remember this full form. Dumbbells. Dumbbells का full form. D stands for diarrhea. D stands for dilatation of the blood vessel. U stands for urination. M stands for meiosis with accommodation. B stands for bradycardia, bronchospasm. E stands for erection. LSS stands for lacrimation, salivation, and sweating. And the last S stands for increased secretion of acid. So these are the actions of acetylcholine that has taken place, that can take place in the human body. Very good. So Dr. Kavya has asked very good question, that blood vessels should be contracted, it should not be dilated. Yes, Dr. Kavya, I agree with you. But do you know, in 1998, this experiment was done. And in this experiment, it has been proved that in blood vessels, we have the presence of muscarinic 3 receptor, right? In blood vessels, we have the presence of muscarinic 3 receptor. So whenever acetylcholine act on this muscarinic 3 receptor, when these blood vessels, one enzyme is induced. The name of the enzyme is nitric oxide synthase enzyme. So muscarinic 3 is stimulatory. I agree. And because it's a stimulatory, it will do some stimulation. And the stimulation is in the form of nitric oxide synthase enzyme. Now this nitric oxide synthase enzyme will form nitric oxide. And this nitric oxide is the one that will stimulate one enzyme known as guanyl cyclase enzyme. And this guanyl cyclase enzyme will increase the level of cyclic GMP, and this cyclic GMP can cause vasodilation. So this is how the vasodilation will take place in the body. And Dr. Kavya, do you know this is the experiment which has changed the whole medical science. And for this experiment, scientists got the Nobel Prize. Scientists got the Nobel Prize for this experiment because after this experiment, whole medical science has changed. Now you have raised this question. I really wish that you also get Nobel Prize in future. So keep on discovering these kind of things because these are the things which actually stimulate your mind. Okay, how this vasodilation takes place. Right, Dr. Kavya, I'm so impressed with you that you have asked this question. Now it's your duty to remember this whole pathway. Right? So, Dr. Kavya, how blood vessels are dilated, you have to remember each and every step. Each and every step is MCQ in your exam. So, blood vessels may we have muscarinic 3 receptor. One enzyme is induced. The name of the enzyme is nitric oxide synthase enzyme. Now this will form nitric oxide. Now nitric oxide will induce one enzyme known as guanyl cyclase enzyme. This guanyl cyclase enzyme will increase cyclic GMP. This is very, very, very important to know cyclic GMP. And cyclic GMP will cause vasodilation. So this is the experiment for which scientists got the Nobel Prize. Right? So this is the reason for blood vessels will be dilated. Dr. Subham Kumar Bhaumik, itna क्यों लिखा यार? Mostly M3 smooth muscles contraction. Yes. Bronchial muscles will be contracted. Yes. Blood vessels are dilated. Yes. Yes, Dr. Subham Kumar, very good. We have given the reason why blood vessels are dilated. Dr. Subham Kumar, please answer me. You are a male or female? Dr. Subham Kumar, we want to know. You are male, female. Dr. Subham Kumar, as the name suggests, you are a male, right? Dr. Subham Kumar Bhaumik. Dr. Subham Kumar Bhaumik, we want your answer. Okay. So, Dr. Subham Kumar, very good. Dr. Subham Kumar, dekho, look at here, this reaction. How this takes place in male? Any idea? Erection. Because in erection, what happens? Even the penile blood vessels are also dilated due to nitric oxide. And when these penile blood vessels are dilated, then the blood is filled in the penis, then only erection is possible. Right? So erection is possible in male patient when only parasympathetic system is activated and penile blood vessels get dilated and the erection will take place. So this is very, very important reaction. So now you and Dr. Kavya will remember this reaction. I will ask these questions again and again from you people. Sumam Kumar and Kavya, your duty is to remember all the steps, how the nitric oxide will take place, synthesis will take place, and how it will cause relaxation of the blood vessel. That is all about this discussion of basic physiology of parasympathetic system. Now let's start with the drugs. So the medicines that will act on this parasympathetic system, we have two types of medicines that we have already covered. One is known as cholinergic drugs. One is known as cholinergic drugs. Second is known as anticholinergic drugs. So we have two types of medicines that we have already covered, cholinergic and the anticholinergic drugs. Now, cholinergic drugs are those medicines which will lead to dumbbells as the effect in the body. So, cholinergic drugs are those medicines which will lead to dumbbells as the effect in the body, and anticholinergic drugs are those medicines which will lead to opposite to dumbbells as the effect in the body. So, these medicines will lead to opposite to dumbbells, and cholinergic drugs will lead to dumbbells as the effect in the body. So cholinergic drugs, dumbbells, anticholinergic drugs, they will act opposite. So they will do opposite to dumbbells. Now let's start with cholinergic drugs first. Okay, before starting with cholinergic drugs, I would like to know one point from you people. Who will tell me in this mnemonic of dumbbells, what does this U, B, and this E stands for? U, B, and E stands for what? Three things you have to answer me. Then only I will come to know that you people have understood. So in dumbbells mnemonic, U stands for what, B stands for what, and E stands for what? Anyone would like to answer? So answer is, and if possible, answer M also in case is possible. Very good. So Dr. Nihala has answered. Dr. Urination, bronchospasm, bradycardia, erection. Very good answer. Very good. So B stands for two things basically, bradycardia and bronchospasm, and E stands for erection, and M stands for meiosis. Meiosis means small pupil. Meiosis means the pupil size is small. Mydriasis means pupil size is more. Good. Now, okay, now we have drugs. Let's start with the first group of medicines. We call them cholinergic drugs. Now, cholinergic drugs are of two types. We have two types of cholinergic drugs. The first is known as directly acting drugs. First type of medicines are known as directly acting drugs. Second type of medicines are obviously known as indirectly acting. है ना? If one group is directly acting, other group will be indirectly acting drugs. So we have two types of medicines, directly acting and indirectly acting medicines. Right? Now let's start with directly acting medicines. Now, directly acting medicines are those drugs when given to a patient, they will stimulate only muscarinic receptor. So these medicines are given to stimulate only muscarinic receptor. That's why we call them directly acting medicines. Right? Now, if we talk about indirectly acting medicines, directly acting, they will directly act on muscarinic receptor and will lead to Dumbbell's as the effect. Now, indirectly acting medicines are the one which are inhibitor of acetylcholine esterase enzyme. Guys, who will tell me what is acetylcholine esterase enzyme? Medicines are inhibitor of acetylcholine esterase enzyme. Who will tell me what is acetylcholine esterase enzyme and what will happen if I block this enzyme? Anyone would like to answer? I have given you one option. I have asked a question from you people. Yes, doctor, your dentist 27 on YouTube. Now you have to answer me this question. Nation wants to know. Nation wants to know. Indirectly acting drugs are inhibitor of acetylcholine esterase. Very good. They're inhibitor of acetylcholine esterase. What is this enzyme? And what will happen if I block this enzyme? What will happen if I block this acetylcholine esterase enzyme? Which neurotransmitter is not going to metabolize? Very good. So your dentist 27 has given the correct answer on YouTube that acetylcholine level will increase. And when this acetylcholine level is increased, because acetylcholine cannot be metabolized, so acetylcholine level will increase. Now acetylcholine has an option to act on three types of receptor. Now this acetylcholine can act on muscarinic receptor. This acetylcholine can act on NM receptor. This acetylcholine can also act on NM receptor. Right? So this can result in action on all these three type of receptor. Have you understood the difference between two? So directly acting medicines are given to stimulate only muscarinic receptor, but indirectly acting medicines are given to stimulate any of the receptor. There is a difference between two group of medicine. Now let's start with the first group of medicines, the medicines which are directly acting. So the medicines which are directly acting, the first medicine which belong to this class, the first medicine which belong to this class, the medicine name is bithenecol. The first drug name is bithenecol. So bithenecol is a name of a medicine. If you look at the name of this drug, bithenecol, the drug name is bithenecol. Now bithenecol is a medicine which is having the word cholinergic in its name. So this drug is a cholinergic drug. So this medicine is a cholinergic drug. So from here, the name you can find out this medicine is a cholinergic drug. Now from this word bithenecol, it starts with alphabet B. So bithenecol starts with alphabet B. So this medicine will act on bladder. So this medicine will act on bladder. And because this medicine will act on bladder, in the mnemonic of Dumbbell's, you people have already answered. The U stands for urination. So this medicine can cause contraction of bladder. So this medicine can contract the bladder. And because this medicine can contract the bladder, this medicine helps in urination. So this is a cholinergic drug. This medicine can act on the bladder, can result in urination. Now nation wants to know. Nation wants to know if medicine can contract the bladder. You people answer. In which condition you will use the medicine? Patient will come to you with which type of complaint so that you want to contract his bladder. So patient has come to you and patient will say which complaint or patient would be suffering from which problem so that you will write bithenecol as a tablet in the patient prescription. Anyone would like to answer? B stands for bladder. B stands for buthanol. This will help in urination. So this medicine is considered as DOC. DOC means drug of choice. This medicine is a drug of choice for a condition where the patient suffer from post-operative. Patients suffer from post-operative retention of urine. So any patient who is not able to pass urine after surgery, patient who is not able to pass urine after surgery, patient bladder is atonic. Patient bladder is atonic, so we call it atonic bladder. So patient bladder is paralyzed. Patient bladder is atonic. We call it post-operative retention of urine. We can use the medicine Bithenecol. Dr. Kavya, Dr. Vishali, in treatment of BPH, generally we do not give the medicine. Look at here. If I say this is the bladder and this is the urethra, right? So in BPH, the problem lies in the obstruction of the urethra, right? So in this patient, the bladder contraction is normal. If you look at the bladder can contract normally. So in this patient, bladder can contract normally. But in case of BPH, the problem is present at the neck, like there is obstruction in the passing of the urine. So bladder is already contracting here, right? So I cannot use this medicine. Look at and think about a condition where the patient bladder is not contracting at all. And the patient bladder is not contracting after surgery. Like during surgery, you have given anesthesia drug. Now, because of the anesthesia drug, patient is not able to pass urine. Do you know, Dr. Vishali, what happened? Actually, whenever we do any surgery, like whenever we perform any major surgery, after the major surgery, patient is admitted in hospital in a post-operative room. And we will not discharge the patient. We always go to ask the patient whether he is able to pass urine or not, whether he is able to pass motion or not. And once the patient is able to pass urine, once the patient is able to pass motion, then only we will discharge the patient. Without passing urine, without passing motion, we will not give, we will not discharge the patient from hospital. So this medicine is given for the treatment of post-operative retention of urine and given for atonic bladder. One of the important side effect of this medicine is bronchospasm. So one of the important side effect of this medicine is bronchospasm. So guys, please remember B stands for Bithenecol, B stands for bladder contraction, and B also stands for its side effect, that is bronchospasm. So this medicine can cause bronchospasm. This medicine can cause bronchospasm, right? Now on the basis of bronchospasm, who will tell me to which type of patient I should not start this medicine? To which type of patient I should not start this medicine? Patient will be suffering from which disease? I cannot give this drug to that patient. Contraindication. The S oblique E stands for side effect. C oblique I stands for contraindication. In which patient I will not give Bithenecol? Patient will be suffering from, very good, Dr. Kavya. So Dr. Kavya has given the patient is asthmatic patient. Wonderful answer. So the patient is asthmatic patient, and Dr. Suresh Babu, Dr. Kavya, just for our convenience, I will write asthma as a full name, that is bronchial asthma. So in a patient of bronchial asthma or in a patient of COPD, I will not give Bithenecol. So just to sake of the mnemonic, I will say everything here starts with B. So B stands for Bithenecol. B stands for bladder contraction. Given as the drug of choice for atonic bladder. Given side effect is bronchospasm and should not be given to a patient of bronchial asthma and COPD. This is about the drug Bithenecol. So Bithenecol is a medicine which is useful for retention of urine. This is all about the first drug, which is a directly acting medicine. Drug name is Bithenecol. Now let's talk about the second medicine. Now second medicine, the drug name is Civimeline. So the medicine name is Civimeline. So drug name is Civimeline. Second drug is pilocarpine. So pilocarpine and Civimeline are the two medicines. Civimeline and pilocarpine are the two medicines. Now these two medicines, when given to a patient, these medicines will act on M3 receptor, and by acting on M3 receptor, these medicines can result in salivation. And because these medicines can result in salivation, cevimeline and pilocarpine, they will directly act on muscarinic receptor, can result in salivation. So these medicines are given for the treatment of dry mouth. So these medicines are given for the treatment of dry mouth. These medicines are given for the treatment of xerostomia. Medicines are given for the treatment of xerostomia or the dry mouth, right? So medicines are given for xerostomia and dry mouth. The drugs are cevimeline and pilocarpine, right? Now, out of these two, which drug is better to start? Cevimeline is better to start and pilocarpine is better to start. So any patient who has dry mouth, now why the patient can have dry mouth? The patient can have dry mouth as a part of Sjogren's disease. So as a part of Sjogren's syndrome, the patient can have dry mouth. The patient can have a patient of oral cancer. So in a patient of oral cancer, after the surgery you have done or you have given some radiation therapy. So after the radiation therapy, patient can have the dry mouth. So first of all, you tell the patient to take the basic precautions, right? You tell the patient for the conservative treatment. You tell the patient for the conservative treatment. In the conservative treatment, you tell the patient to have the frequent sips of water. You can tell the patient to have the frequent sips of water. So you can tell the patient to have the frequent liquid intake, frequent sips of water, conservative treatment. After that, you can tell the patient to use the artificial saliva. You can tell the patient to use the artificial saliva. Now, even artificial saliva is not able to control. The artificial saliva is not able to control the xerostomia. Then you will move on to the drugs. So we have the two medicines. One is known as pilocarpine. But pilocarpine has a problem. Whenever you give pilocarpine, patient can have the risk of bronchospasm again. So patient will have the risk of bronchospasm again. The second drug is cevimeline, right? So second drug is cevimeline. So cevimeline is one more drug that you can give, but this medicine has a risk of causing the diarrhea. So this medicine can cause diarrhea and pilocarpine can cause bronchospasm. So mnemonic is dumbbells and we have to judge which side effect is more comfortable by the patient, cevimeline or pilocarpine, which drug is better, right? So pilocarpine or cevimeline, pilocarpine can cause bronchospasm, cevimeline can cause diarrhea. There is uh, not a clear cut answer like which is better to use. So as per the clinical scenario, you have to choose the best medicine for the treatment of dry mouth. So these are the two medicines which are given for the treatment of dry mouth. One is pilocarpine, second is cevimeline, right? So next we have a one more drug here. Drug is pilocarpine once again. Now please remember, pilocarpine is a drug. If you read the name of this medicine carefully, if you read this letters in reverse direction, COLI. So this is cholinergic drug. So if you can remember this is the cholinergic medicine. So pilocarpine, you can read in a reverse direction. It's a cholinergic drug. Now, if you look at the name of this medicine more carefully, this medicine is having the words P and I. So this medicine will make your pupil pinpoint. So this medicine can make the pupil pinpoint. So pilocarpine is a drug. This will make your pupil pinpoint. And when this medicine will make your pupil pinpoint, it means your pupil will have the meiosis. So meiosis means your pupil has become very point, like very small, like a point of a, like a pin point, like a point of a pin. Like this is the point of a pin. So pupil size become very small, meiosis. Now because of this meiosis, please remember, this medicine can cause peripheral angle. There is an angle in the eye. We call it peripheral angle of the eye. So this peripheral angle become wide. So peripheral angle will become wide. And when this peripheral angle will become wide, this will increase the drainage of aqueous humor. So you have one fluid in your eyes, that is aqueous humor. So this medicine can increase the drainage of aqueous humor in this peripheral angle of the eye. So in this peripheral angle of the eye, aqueous humor drainage will increase. And when this aqueous humor drainage will increase, the pressure in eyes will go down. When the pressure in eyes will go down, any idea for which disease I can use this medicine? Pilocarpine, if I say pilocarpine starts with word PI, this medicine will make the pupil pinpoint. This medicine will open the peripheral angle. P stands for peripheral angle, P stands for pinpoint pupil, and P stands for pressure in eyes. So pressure in eyes will go down. When the pressure in eyes will go down, any idea for which disease I can use the drug pilocarpine? So pilocarpine is a medicine. This is given for the treatment of glaucoma. Wonderful answer. So this medicine is given for the treatment of glaucoma. And guys, please remember one glaucoma name. The name of the glaucoma is angle closure glaucoma. You can easily understood from this discussion that medicine is given for that glaucoma where the angle has a problem. So there are two types of glaucoma. One is open angle glaucoma, one is angle closure glaucoma. So if I say the medicine is opening up the angle, if I say the medicine is causing the widening of angle, so it means the problem of angle is there, right? So angle का problem है, तो angle closure glaucoma, pilocarpine is one of the drug that is useful. So pilocarpine is given for angle closure glaucoma as a drug. Now if we talk about the medicine side effect, now medicine side effect, if you can remember, this medicine can cause peripheral retinal detachment. So one of the side effect of this medicine is peripheral retinal detachment. So again, this starts from alphabet P. So pilocarpine starts with P, I. This will make the pupil PI, that is pinpoint. This will cause widening of P angle, peripheral angle, reduce the P in the eyes, pressure in the eyes, and this can cause peripheral retinal detachment. Again, starts from alphabet P. So here everything starts with letter P. Yes, cevimeline has one doubt has come from YouTube. Cevimeline has long duration. Cevimeline has long duration. Yes, agree. Cevimeline ko we give TDS and pilocarpine is given QID. So patient comfort is more with cevimeline in terms of number of times. Cevimeline has long duration. It is given TDS 3 times daily and pilocarpine is given QID 4 times daily. Cevimeline has long duration of action. Agree. It has a long duration of action, right? And pilocarpine is comparatively shorter action. I will not say very short, it has a shorter action. But cevimeline has GIT side effects. Pilocarpine can cause bronchospasm. So in case you are not bronchial asthma patient, pilocarpine will not cause any problem. But in case you don't have any problem, cevimeline will definitely cause diarrhea. So confusion hai like which is better to mark. Okay. This is all about medicines which are directly acting. So directly acting medicines we have covered. So directly acting medicines, please remember 3 names: cevimeline, pilocarpine, and the third is bethanechol. Now let's talk about indirectly acting medicines. So if we talk about indirectly acting medicines, they are the inhibitor of acetylcholine esterase enzyme. So these medicines are inhibitor of acetylcholine esterase enzyme. Right? So we'll discuss these medicines in detail now. Right? Now let's discuss them separately. So medicines which are indirectly acting. So the medicines which are indirectly acting cholinergic drugs. So the medicines which are cholinergic drugs. So cholinergic drugs are those which will lead to dumbbells as a effect. So these medicines will do dumbbells as a effect, but they are indirectly acting. So how these medicines will act in the body? They are inhibitor of acetylcholine esterase enzyme. They are inhibitor of acetylcholine esterase enzyme. Now, how these medicines inhibit this acetylcholine esterase? There are two ways. Some of the medicines are known as reversible acetylcholine esterase inhibitor. Some of the medicines are known as irreversible acetylcholine esterase inhibitor. Some of the medicines are reversible acetylcholine esterase inhibitor. Some of the drugs are known as irreversible acetylcholine esterase enzyme inhibitors. Now, the reversible medicines are those when given to a patient, these medicines will form electrostatic bond with the enzyme. So these medicines will form electrostatic bond with the enzyme. Now the irreversible medicines are those which will form covalent bond with the enzyme. So these medicines will form covalent bond with the enzyme. That's why the block is irreversible. So the reversible blockers will make electrostatic bond. Irreversible blocker will make covalent bond. Agree, right? Now the irreversible acetylcholine esterase. these are the poisons for human being. So these are the poisons for human being, but reversible medicines are clinically useful drugs. So these are the clinically useful drugs, but irreversible medicines are the poisons for human being. If we talk about the names of these poisons, the important poison here is known as organophosphate poison. So organophosphates. So organophosphates are the chemical compounds that we used in agriculture. So we use them in agriculture. The name we use them in agriculture. So in agriculture, we use this chemical compounds as an insecticides and pesticides. We use this as a insecticides and pesticides. So we use them as the insecticides and pesticides in agriculture. So whenever any person will consume this poison, any person who will consume this poison either by mistake or if a person wants to commit suicide. So patient wants to commit suicide, patient will consume this medicine. Yes, one brand name Dr. Vishali has given, Difloss. Very good, doctor. I'm so happy to you. Like my audience is such an interactive and such an intelligent audience. So one of the example is of this insecticides and pesticide is like one is difloss, one is malathion, parathion. All these chemical compounds are there. So the chemical names are malathion, parathion. These are the actual names. So malathion, parathion poisons, organophosphate poison. Now, whenever patient will consume this poison, patient symptoms will be like dumbbells. Patient symptoms will be like dumbbells. This we have already covered. So patient will come to you with all these symptoms, and we discussed already. All these symptoms are due to which receptor? Answer is muscarinic receptor. So muscarinic receptor is the one that is responsible for all these symptoms. So any idea which drug will be used as an antidote? Which drug I can use as an antidote? So the antidote will be the muscarinic blocker. So any drug which is muscarinic blocker, any drug which is muscarinic blocker will be used as an antidote. So all the symptoms are due to mm, uh, cholinergic actions, dumbbells, because they have blocked the acetylcholine esterase enzyme. So by blocking acetylcholine esterase, acetylcholine level is increased. Acetylcholine is acting on muscarinic receptor and causing the symptoms, that is dumbbells. So we have to block this dumbbells. We have to block this muscarinic receptor. So I have to give one anticholinergic drug. I have to give one anticholinergic medicine and the drug which is anticholinergic drug. So there is a drug which is known as anticholinergic drug. Drug name is atropine. So please guys remember A stands for atropine, A stands for anticholinergic drug. A stands for atropine, A stands for anticholinergic medicine. So atropine is an anticholinergic drug. This is used as a best antidote. This is considered as best antidote of organophosphate poisoning. So best antidote of organophosphate poisoning is atropine. So atropine is the best antidote for organophosphate poisoning. Now, apart from this atropine, we can also use a medicine that is known as oximes. There's a group of medicines, we call them oximes. Now, please remember, oximes are the medicines which start with alphabet O. So they are given for OP poisoning. OP poisoning means organophosphate poisoning. So oximes are the medicines which are also given for OP poisoning or organophosphate poisoning. So we have a drug like Dr. Subhan Kumar Bhomik has already mentioned the name of the drug. The name of the medicine is pralidoxime. So pralidoxime is a drug. This medicine can be used. So pralidoxime is the name of a medicine which is actually an oxime. So we have many drugs actually. We have many drugs which are known as oxime. One of the drug is pralidoxime. So pralidoxime is a medicine which is also given in OP poisoning, but this medicine is used only as an enzyme reactivator. So this medicine is used as an enzyme reactivator. So this medicine can be used as an enzyme reactivator. So we know that enzyme is blocked irreversibly. So this medicine can be given as an enzyme reactivator. So this will make the process of recovery faster. So this will make the recovery faster. So this is given to make the recovery faster. This is used as an enzyme reactivator. So this is used as an enzyme reactivator. This will make the recovery of the patient faster. But guys, whether the patient will recover after 1 day, 2 day, 3 days, 14 days, 10 days, which drug is life saving? Answer is atropine. Atropine is the main medicine that will save the patient life because this is controlling the symptoms which are responsible for death. Do you know, guys, dumbbells में क्या होगा? Like patient will get bronchospasm, patient cannot breathe, patient will have meiosis, patient will have diarrhea, patient will have bradycardia, patient BP will go down. Now here the E stands for epilepsy. Patient can have the epilepsy, not the erections. So this medicine atropine will save the life. This is the best medicine, but pralidoxime can be used as an enzyme reactivator and make the process of recovery faster. Now let's talk about the reversible medicines. Now the medicines which are reversible drugs. Now these medicines will increase the level of acetylcholine in the body. Now, acetylcholine can act on three types of receptor. Acetylcholine can act on nicotine N receptor. Acetylcholine can act on muscarinic receptor. Acetylcholine can also act on nicotine M receptor. So acetylcholine can act on three types of receptor: nicotine N, muscarinic, and nicotine M. Now, before starting with the name of the drugs, who will tell me the location of nicotine N receptor in the body? Till the time I will have the water, you people have to answer me where we have the nicotine N receptor present in human body. So where we have the nicotine N receptor present in human body, anyone would like to answer? Very good. So nicotine N receptor is present at nerve and nerve junction, and this nerve and nerve junction is in autonomic system we call it ganglia, and in CNS we call it nucleus. So these medicines will act on CNS, and in CNS these medicines will stimulate a nucleus. The name of the nucleus is memory center. So these medicines will stimulate your memory center. So these medicines will act on the nucleus that is involved in maintenance of your memory. So these medicines which will improve your memory. These medicines are memory enhancing drugs. They are given for the treatment of dementia. So any patient suffer from dementia. Dementia means forgetfulness. Patient cannot remember the events of the life. Dementia. This is a characteristic symptom of a disease. Anyone would like to answer which disease? So which disease can have the symptoms of dementia? What is the name of a disease where the patient will have the dementia? Anyone would like to answer? Patient will have the dementia in a disease. That disease is known as Alzheimer's disease. The disease is known as Alzheimer's disease. So patients who suffer from Alzheimer's disease. So patient who suffer from Alzheimer's disease, patient will come to you with dementia. So please remember guys, Alzheimer's में A stands for acetylcholine, D stands for deficiency. So patient will have acetylcholine deficiency in the brain. In Alzheimer disease, the patient will have acetylcholine deficiency in brain. And because of acetylcholine deficiency in brain, patient will have this problem of dementia. So we have a drugs which can stimulate the memory center. So we have the medicines which can stimulate the memory center, and we can use these medicines for dementia. We can use the medicine for Alzheimer. Drug name is donepezil. So please remember, donepezil is a drug. Donepezil is a medicine. It is overall considered as drug of choice. It is the best medicine for the treatment of dementia or Alzheimer disease. Drug name is donepezil. Now we have one more drug that is also useful for dementia. Drug name is rivastigmine. So donepezil, rivastigmine are two medicines which are given for dementia. So guys, please remember, D stands for dementia, D stands for donepezil. So D stands for donepezil, D stands for dementia. It is the best medicine for the treatment of Alzheimer's disease. So best drug for the treatment of Alzheimer's disease is donepezil. So D stands for dementia, D stands for donepezil. One more drug in case you can remember is rivastigmine. So rivastigmine is a medicine which can help in recalling the events of your life. but donepezil is an important drug. D stands for dementia. D stands for donepezil. Now we have a drug which will act on muscarinic receptor. The medicine that will act on muscarinic receptor, drug name is physostigmine. So we have a medicine, they call it physostigmine. So physostigmine is a drug which will act on muscarinic receptor. And when this medicine will act on muscarinic receptor, this medicine is considered as drug of choice. This medicine is considered as drug of choice or antidote of choice. Drug of choice or antidote of choice for atropine poisoning. So guys, please remember atropine poisoning. Atropine is an anticholinergic drug. Atropine is an anticholinergic drug which is blocker of muscarinic receptor. Atropine is a drug which is blocker of muscarinic receptor. So if your muscarinic receptor is excessively blocked, if your muscarinic receptor is excessively blocked, you have to open it. And how will you open the muscarinic receptor? By giving a drug known as physostigmine. So please remember, physostigmine is a drug. This is considered as antidote of choice for atropine poisoning. Now, guys, please remember, atropine poisoning is also known as datura poisoning. Atropine poisoning is also known as datura poisoning, and in foreign countries, it is also known as belladonna poisoning. It is also known as datura poisoning and belladonna poisoning. So belladonna means beautiful ladies poisoning. So in foreign countries, in history, beautiful ladies used to keep atropine eye drops in their purse or in their wallet. So we call it beautiful lady poisoning. Datura is a name of a plant. If you consume this datura fruit, the extract of this extract of the datura contains atropine. So you will have the atropine poisoning, belladonna poisoning. We also call it uh, atropine poisoning, and the antidote of choice is physostigmine. Now, guys, please remember in this atropine poisoning, the patient can have the CNS symptoms. So, patient can have the CNS symptoms in atropine poisoning. So, physostigmine is a drug which can act on CNS also. So, this medicine, physostigmine, can act on the CNS and can take care of all the symptoms of atropine poisoning. So, physostigmine is a medicine which is best medicine for the treatment of atropine poisoning. Yes, the name of the plant is also Atropa belladonna, but belladonna actually means the beautiful lady poisoning. So in history, the beautiful females or all females used to keep atropine drops in their purse. So whenever they used to feel the danger, they used to mix the atropine drops in the drink of that person, and that person used to die on the table. Right. So that was the beautiful lady poisoning or belladonna poisoning. In India, females never use this drug, right? India, mein all females are beautiful, so we don't require these drugs for that, right? Okay, now NM receptor. Now, where do we have the NM receptor? Now, NM receptor is present on the voluntary muscles. So, these medicines are given to improve the strength of voluntary muscles. So, these medicines are given to improve the strength of the voluntary muscles. So, whenever your voluntary muscles are weak, you want to improve the strength of voluntary muscles, you have to use these medicines. Now, which medicines belong to this class? We have a drug known as pyridostigmine. So we have a drug name is pyridostigmine. So the medicine name is pyridostigmine. Now pyridostigmine is a drug. This medicine is given for a condition as a drug of choice where the patient will have muscle weakness. Patient will have voluntary muscle weakness. Like for example, if I talk about example Dr. Subham Kumar, like Dr. Subham Kumar is my student and I'm teaching him, right? So gradually what will happen? Dr. Subham and me become friend, right? So when the Dr. Subham and me become friend and we want to shake our hands, so I will say, Dr. Subham, shake hand. So he will just lift his hand to shake the hand with me, but he cannot lift the hand. Why he cannot lift the hand? Why Subham cannot lift the hand? Because he has a weakness of his hands. He cannot do the shake hand. He cannot make friend of me. He cannot be friend of me, friend of mine, because he cannot lift his hand. He cannot extend his hand to shake a hand with me. Why? Because he has some muscle weakness. What is the name of a disease, Dr. Subham? If the patient is not able to lift his hand, then patient is not able to open his eyelid. What is the name of a disease? The name of a disease is, the name of a disease is, we call it myasthenia gravis. The name of a disease is myasthenia gravis, where the myasthenia means muscle, gravis means graveyard. It means patient muscles are in graveyard. Patient muscles are in graveyard. Patient cannot lift his hand to shake the hand with you. So myasthenia gravis, patient has a difficulty in movement of body movements. So we call it myasthenia. Myasthenia means muscles. Gravis means graveyard. Drug is pyridostigmine. And guys, if you understand Hindi, in pyridostigmine we have a drug dosti, right? So whenever you make dost in your life, whenever you want to make dost in your life, you have to lift your hand to make the dost. But you can lift your hand to make a dost if you have taken pyridostigmine. So pyridostigmine is having the word dosti. It is given to improve the muscle strength so that you can make more dost in your life. And if you understand Hindi further, please remember this physostigmine. Physostigmine is having the word sosti. In Hindi, sosti means the drowsiness, the susti. Susti means the drowsiness. The CNS is not working properly. We call it physostigmine. So physostigmine is a CNS active drug because when the questions are asked in your exam, you always get confused between physostigmine and pyridostigmine. So please remember, pyridostigmine is having the word dosti. This is the drug that will act in periphery. This is the medicine that will act in periphery and helps you to make more dose in your life. But physostigmine is a medicine that is having the word sosti. Sosti means that will make you sust. Sust means CNS is down if you understand Hindi. Right? So that will make you more CNS depressive action. So physostigmine is a CNS depressive medicine and pyridostigmine is a medicine that will help you to make dose in your life. Right? So pyridostigmine is drug of choice for myasthenia gravis. Now we have a drug known as neostigmine. We have one more medicine belong to this class. The drug name is neostigmine. So we talk about this medicine, neostigmine. Now neostigmine has a property. It has a very fast onset of action. And because this neostigmine has a very fast onset of action, we can use this medicine for acute emergencies. I can use this medicine for acute emergencies. So drug has very fast onset of action. So I will use this medicine for acute emergencies. For example, so I will use this medicine during acute emergency. So acute emergency treatment, I can use the medicine that is neostigmine. So this medicine is given for the treatment of cobra bite. So whenever you are bitten by a cobra, so whenever the patient is bitten by a snake or the cobra, so during the snake bite, you have to give the anti-snake venom. After giving anti-snake venom, you have to give this medicine neostigmine. So neostigmine has a fast onset. Patient is bitten by the cobra. So cobra bite mein neostigmine, which is used as a fast-acting medicine, is one of the drug that is useful. Number two, this medicine is also given for reversal of skeletal muscle relaxant medicine. So this medicine is given for the reversal of skeletal muscle relaxants. Like we discussed already, skeletal muscle relaxants are the one which will block the NM receptor. So during surgery, when you block the NM receptor, now after the surgery is done, you want that patient muscles should recover. So for the recovery of the patient muscles post-operatively. So after the surgery, if you want the muscles to recover from the effect of the skeletal muscle relaxant, you can use neostigmine as a opposite drug. So this is given for the reversal of skeletal muscle relaxant. Now in both conditions, you require the fast action. In both conditions, whether the patient is bitten by cobra or patient wants the reversal of skeletal muscle relaxant, patient wants the fast action of the drug, and neostigmine is a medicine that is useful. Now, the last medicine which belong to this class is known as edrophonium. So we have a last medicine. The drug name is edrophonium. So edrophonium, guys, please remember, edrophonium is a very short acting medicine. This medicine has a very short action in the body. And because of the short action, I cannot use this medicine for treatment of any condition. I will use this medicine only for making the diagnosis. Right? I will use this medicine to make the diagnosis of myasthenia gravis. So whenever I have to make the diagnosis of myasthenia gravis, I will use the medicine edrophonium. And the name of the test is tensilon test. Name of the test is tensilon test. Right? So edrophonium is a medicine that I can use to make the diagnosis of myasthenia gravis. The test is known as Tensilon test, but this test is outdated these days. So questions are not asked these days. So outdated test questions are usually not asked. Right? This is an outdated topic that which drug is given to make a diagnosis of myasthenia gravis. The answer is edrophonium. It used to be asked around 4 to 5 years back, but nowadays this test is not done. That's why this question is not asked. So in case you want to leave this drug, you can leave this medicine. This is not very important drug for your exam, but other two medicines are important. Right? So pyridostigmine is important, neostigmine is important. This is all about the topic that is cholinergic drugs for you. So cholinergic drugs topic is done. Now, in cholinergic drugs, you people have to answer me one question. I write few questions, you have to answer me. Who will tell me what is a drug of choice for OP poisoning? You have to give me the answer. What is the drug of choice for OP poisoning? What is the drug of choice for atropine poisoning? Who will tell me the drug of choice for OP poisoning or atropine poisoning? Anyone would like to answer? Which medicine is best medicine for OP poisoning? Which medicine is best medicine for atropine poisoning? So OP poisoning is a type of cholinergic poisoning where the patient will have symptoms which are dumbbells. But atropine poisoning is just opposite of that poisoning where the patient will have symptoms which are opposite to dumbbells. Right? So in OP poisoning, the antidote of choice is atropine. But in atropine poisoning, I don't use organophosphate because these OPs are also poisons. So in atropine poisoning, I will not use organophosphate because organophosphates are also poison. एक poison में दूसरी poison we cannot give, right? So in atropine poisoning, I will give physostigmine or pyridostigmine. I will give physostigmine. So I will use physostigmine for atropine poisoning and I will give atropine for OP poisoning, right? Organophosphate poisoning, atropine is antidote, but for atropine poisoning, physostigmine is antidote. Okay, fine. This is done. Now, who will tell me where do we use this medicine, donepezil? Where do we use the drug donepezil? Where do we use the medicine bithenecol? Who will tell me where do we use the medicine donepezil and bithenecol? Please answer me this question. Where do we use medicines like donepezil and bithenecol? So donepezil we have discussed. It starts with what D. It is given something for D, and this is given for something with B. Right? And here we can add one more drug, pilocarpine. Pilocarpine is also given for some P. Very good. So donepezil is given for dementia. Bithenecol is given for bladder atony. And pilocarpine is given to reduce pressure in eyes. So pilocarpine is given to reduce pressure in eyes. Bithenecol is given for bladder atony. And donepezil is given for dementia. Very good. Now, you people have to answer me one more question. Tell me the two drugs. Tell me the names of two medicines which are given for dry mouth. Tell me the names of the two medicines which are given for dry mouth. So, which medicines are given for dry mouth? Two medicines which are given for dry mouth. So, two medicines which are given for dry mouth. Very good. So, medicines are pilocarpine. So, pilocarpine is given for dry mouth, and second is cevimeline. So, these medicines are given for dry mouth. Good. Now, the last question before we take a break because it's already 2.5 2 hours, more than 2 hours. Last question, botulinum toxin. Botulinum toxin, please tell me botulinum toxin mechanism of action. What is the mechanism of action of botulinum toxin? Or can you solve this question for me? Question number one, who will give me the answer? Who will give me the answer of question number one? What is the answer of question number one? No, that's fine, Dr. Anna. That's fine. That your answer is correct. Whatever you have answered is correct. Anmol, answer is correct. But in this question number one, it's a Ames question. You have to answer this Ames question. So ILS CT Ames question. Question number one. What is the answer? Okay, guys, try to read the question carefully. Here, both A and D are the possible answers. These are the Ames question, so they are not that easy. This is Ames question, so that's not that easy. You have to find out a most appropriate answer. So A and D both are possible, but out of this A and D, you have to choose the best answer. So out of A and D, the best answer is D Delhi. Yes, the answer is D Delhi. So D is the best answer. The medicine will act on the presynaptic. Medicine will act on presynaptic terminal, right? So medicine will act on presynaptic terminal, right? So answer is D. D is a better answer to mark. Okay. Question number five. Question number five. Can you please answer this question? Question number five. What is the answer? A diagnosis भी बता दो यार. What's the diagnosis? Can you make the diagnosis? Patient is having symptoms. Can you make the diagnosis? Like which patient is suffering from which disease? Very good. So Dr. NG has given the correct answer. Yes, Dr. Spurti, Dr. Athira, Anmol, all of you have given the correct answer. I think you have got the diagnosis. It's a dumbbells. The dumbbells symptoms है. The dumbbells में it's OP poisoning and the answer is atropine. Okay, now guys, please tell me where do we use this drug here? I would like to know about this medicine, physostigmine. So you people have answered atropine, but where do we use physostigmine as a drug? Where do we use physostigmine as a medicine? The next question is where do we use physostigmine as a best medicine? Anyone would like to answer? Physostigmine. Where do we use physostigmine? Very good. It's given for atropine poisoning. Can you please solve question number 14? Question number 14. Question number 14. Anyone would like to answer? Question 14. Yes. So answer is again yes. Why, doctor? Why here neostigmine is a better answer? Doctor Any Paul, would you like to answer? Why neostigmine is a better answer? Why not any other drug? Like, what's the advantage? What's the advantage of using new stickmin here? So question 14 answer is new stickmin, that's fine. But what's the advantage of using new stickmin? What's the advantage of using new stickmin? Anyone would like to answer? Right. So the answer is new stickmin has faster onset. Very good. Okay, question number 18. Question number 18. Which of the following action is expected out of muscarinic receptor? Yes, neostigmine is better drug because it's a faster acting. All medicines which will act on muscles are only peripheral acting drug. They will not act on CNS. Okay, here in this question, the answer is A. This question is totally based on the dumbbells mnemonic. Dumbbells may erection occurs. Now, Dr. Subham Kumar will answer. Dr. Subham Kumar, how erection occurs in male patient? Subham Kumar, how erection occurs in male patient? How erection occurs in male patient? How the penis blood vessels are dilated? How the penis blood vessels are dilated? Till the time Subham will answer, other students will answer question number 10. Subham को इरेक्शन का आंसर करने दो. You people will answer question number 10. So question number 10, what's the answer? You people are answering sodium. Voltage gated sodium channel. Question number 10. Very good. The answer is B. This is botulinum toxin they are asking. Botulinum toxin, blocker of SNAP25, irreversibly block the entry of calcium ion. And when this calcium will not take entry, acetylcholine will not be released. Acetylcholine will not be released. Question number 17. Answer is very good. This is again OP poisoning. And because of the OP poisoning, the patient should require atropine. Atropine is the antidote. Atropine is the antidote. Fine. So guys, you people are able to answer, and I'm happy to see that it's good that you people are able to answer. Let's take break for some time, right? So it's 7:20 right now by my watch. Very good, Dr. Subham. Very good. ये GI क्या लिखा है यार? IP3. नहीं Subham, just remember, nitric oxide will induce one enzyme. The name of the enzyme is guanyl cyclase enzyme. This enzyme is very important, guanyl cyclase. If you will not write this name of enzyme guanyl cyclase, it will be a problem. Because now these questions will be asked. And this guanyl cyclase will increase cyclic GMP. Now cyclic GMP will cause something that will cause relaxation. That's detail, right? So 7:20 right now. We'll come back at 7:35 or maybe 7. Yes, come back at 7:35. Have some tea or water or maybe some drink. Okay.